I'm really excited to just get to talk a little bit about what it looks like for a pharmacy technician to move into possibly being a pharmacist. And I recognize that we probably have several different demographics in this room, some of which are maybe interested in what this looks like for them, going from a pharmacy technician to being a pharmacist. And for others of you, it might be, well, I'm not necessarily interested in that pathway for myself, but you might be a support system or a mentor to a pharmacy technician that is interested in that path. Or you might have a loved one, a friend or a family member that might be on the pharmacy technician route and is looking to go into a PharmD, and you may be able to share this type of information with them and maybe able to take something away from that. Or if anything else, you take away some of the things that PharmD track looks like as far as a curriculum, as far as what they're involved with. You might be working with pharmacy student interns in your work. You might be working with other students and engaging with other students, whether it's on the campuses that you work at, or whether it's in the pharmacies that you work in. And so hopefully you can take away something regardless of whether you're specifically interested in this type of pathway yourself. And so excited to kind of talk through it with you all. And if there's any questions along the way, please feel free to ask. I'm open to any questions or interruptions along the way. I'm going to try and leave some time for questions at the end too, if you have anything specifically. So as mentioned earlier, I oversee our student affairs at University of Nebraska Medical Center College of Pharmacy. And so that's kind of three buckets for me as far as how I view it. One is the admissions and recruitment side. So that's where I get to talk to our students and prospective students about what it looks like to enter the PharmD world. The other piece is kind of the student success side. So navigating some of the challenges that our students face, either academically or from a more mental health, personal side of things. And so those are kind of the three buckets that I get to work with our students on, and I'm kind of in the admissions and recruitment side of things on a day-to-day basis too with our director of admissions and recruitment. So that's a little bit of background on me. Let's see if we can. All right, so we have learning objectives. I think for all these presentations, there's learning objectives. We'll go through the pathways a pharmacy technician may consider if interested in successfully applying to a Doctorate of Pharmacy program. We'll talk a little bit about the experiences and characteristics that make a quality candidate for PharmD entrance. And then we'll describe some real world examples of technicians who maybe took a non-traditional approach to their pharmacy education. And when we talk about non-traditional approach, that mainly is anything that diverges from going from high school straight into undergrad, straight into PharmD is what we would define as non-traditional, I guess, in our world. So if I use that terminology, you know where that's coming from. So how do we actually achieve those objectives? We'll talk about the workforce landscape in the pharmacy profession. We'll identify prerequisites for applying to pharmacy school, discuss the curriculum a little bit and different opportunities a student would have. And answer any questions that you have regarding the profession and or the application process, or how you might support somebody going through that process. Ultimately, my goal today is to introduce this material. I don't necessarily have a bias one way or the other. I look at several people in this room I've actually gotten to interact with in one way or the other. Specifically, I've gotten to work with Becky here at Nebraska Medicine. She helps support our pharmacists in the ambulatory care outpatient clinic space and does some really incredible work within her pharmacy technician space. And so my goal here is not to convince everybody in this room that they need to get a PharmD. My hope is to just introduce some of the concepts and hopefully allow you to have something in your tool belt, whether it's for you personally or for others. So just a little bit of a caveat there. As far as what the pharmacist job outlook looks like over the course of the next decade, if we look at 10 years down the road, the U.S. Bureau of Labor Statistics says that there will be over 14,000 pharmacist openings each year on average over the course of the next decade. And so that's about on average, when we look at it from a percentage perspective, 4 to 5%. That's about average for occupations across the board. So there's a pretty average or level growth opportunity there for pharmacists. And they even break it down a little bit more. They try and define community pharmacy as well as health system pharmacy. So your community pharmacist working in maybe your independent or larger retail spaces, your health system pharmacists working maybe a little bit more in the clinical decision-making side of things, where they're possibly working with diagnosticians, possibly helping to diagnose themselves. And I think that's kind of the evolving role of what a pharmacist is looking to be in the next 10 years. And so that's kind of the job outlook. So there is a demand out there, especially as we start to see pharmacists exit the workforce or retire over the next decade. So as I mentioned, I work at the University of Nebraska Medical Center, and as the public institution for Nebraska, we are pretty mission driven to make sure that the students that we bring in are also students that are going to be able to take their knowledge and training out back to Nebraska and surrounding states and in the country, but specifically providing pharmacists for our state. And so it's really important for us to be able to take a look at this map and say, okay, these states or these counties that have the diagonal lines with no pharmacists in the county, how do we actually address that? Are there different things that we can do to make sure that our patients throughout the state are able to have access to a pharmacist in some way, shape, or form? And maybe it doesn't mean having a specific physical presence there, but it may mean having some sort of virtual presence there too. And so that's kind of a conversation for us. And I think it plays into the pharmacy technician world too, as to how are we leveling up our pharmacy technicians to be able to provide care in these counties as well. So just something that I look at from a state perspective. And I'm sure similar if you're from Colorado or maybe some Western states in the United States, you'll see a similar type of map where there are counties that don't have pharmacists. As far as pharmacy careers, just wanted to touch a little bit as to the different types of opportunities that pharmacists can step into after graduation. And some of these terms you may have heard of before, and some of them maybe not as much, but growing areas include ambulatory care pharmacy, which would be a pharmacist that works in an outpatient clinic. Maybe that's more in a general sense, where they work in a general internal medicine clinic or a primary care or family medicine clinic, where they're providing recommendations and support to the physicians within those clinics. And maybe it's a little bit more specialized even, where they work in a cardiology specialty clinic, or they work more in a rheumatology specialty or an oncology specialty. And so lots of different ways that pharmacists can work in that area. Emergency medicine, so working in our emergency medicine units in the hospital. Pharmacogenomics or research is a specific growing area for pharmacists, where as we start to learn a little bit more about the human genome, and as we have AI capabilities, we're going to start to be able to learn a lot more about how medications actually interact with specific individuals. And so pharmacogenomics is a growing space. Veterinary pharmacy, infectious disease, both inpatient and outpatient. So pharmacists that are working in the hospital, making recommendations on antibiotics, as well as those working outside the hospital doing more antibiotic stewardship, making sure that we're making the right type of treatment decisions for patients. Compounding pharmacy, I think an area where pharmacy technicians and pharmacists work closely together. And so an area that you may be interested in as a pharmacy technician, looking at a PharmD path. And then community pharmacy, and I recognize I put community pharmacy there twice, and it wasn't on purpose actually. But when I started thinking about, okay, well, how am I going to talk about this with two different community pharmacist pictures? I thought, well, there actually is a little bit of a tie there. I think one is a community pharmacist, and the role of the community pharmacist is really important from the traditional sense of being a dispensing pharmacist. That's how a pharmacy and the pharmacy staff gets paid, is the dispensing role still. And so that traditional role is still going to be very important, not just now, but even 5-10 years down the road. But there's also going to be an evolving role of the community pharmacist over time. And I think you guys got to hear from Don Klebser yesterday talking about point of care testing. kind of the evolving role of what a pharmacist might be doing in the community side, especially as we start to lose primary care physicians. Patients are going to be looking for quick access to care. And so pharmacists and pharmacy technicians are going to be asked to fulfill some of those roles. And so I think that's my justification for having two community pharmacist pictures there. But just a couple stories, sometimes it's easy to put something on a slide and say, hey, this is the pathway to do it. But if nobody's actually ever gone through that path, then it doesn't really make a whole lot of sense. And so we have several different students in our PharmD curriculum right now who have started as a pharmacy technician and worked their way through our PharmD curriculum and ultimately become a pharmacist. And they've taken different ways to get there. Some of them worked as a pharmacy technician in the more maybe traditional role where outside of high school, they work into their undergrad institution and they start with their pharmacy technician certification, and then they work their way into becoming a pharmacy tech, spend 3 or 4 years doing pharmacy tech work in their undergrad institution, and then apply for a pharmacy in a college of pharmacy. But some take a little bit of gap, either after high school or after their undergrad education. And we have students currently enrolled at Nebraska who have spent 10, 15 years working in the pharmacy technician space and then decided to go back and get their education on the PharmD side. And right now we've got some that are balancing those types of roles while having a family and children. We have some balancing those roles just as single adults. And so I think there's a lot of different stories there. One that comes to mind specifically is a student that we have in our 4th year curriculum currently. And he worked as a pharmacy technician initially after undergrad, spent 2 or 3 years in the community pharmacy space. And after a couple of years working as a pharmacy technician, he started to work more in the specialty side of that institution. And he saw pharmacists working with the patients, monitoring their medication, monitoring their blood levels, and making recommendations for their care. And he got to be involved in some of the logistical components of that. And he decided, after watching some of the pharmacists making those recommendations and developing those relationships with patients alongside of him, he's like, this is something that I really want to pursue. And so he applied to our program and had some great experience to rely on as he applied to the program, got accepted, and is doing really great. And I think the cool part about that is he's now taking that experience and it's going to become what it sounds like, maybe a full circle moment where he almost has a job lined up for him over the course of the next year, where he's going to be able to use his experience not just as a pharmacy student working as an intern there, but as a pharmacy tech in the space that he worked in for multiple years prior to becoming a pharmacy student, and then he'll ultimately graduate this fall. And so I think that's kind of a cool way that you can leverage what your current work is, and hopefully be able to work throughout your time in a PharmD curriculum at that same institution if you so choose, and then ultimately be able to become a pharmacist there. So there's some full circle moments that I know employers would be looking for in retaining those students. So just a couple different stories there. So this is the kind of the overarching path as to how a tech might become a PharmD. And we'll highlight each of these different buckets over the next few slides. But the first piece is, wherever you are, is identifying what the coursework looks like as to fulfilling your prerequisites to becoming, be able to apply to pharmacy school. And prerequisites can look different for each institution. A lot of them align in a lot of different ways, but there might be specific prerequisites depending on the college or school of pharmacy that you're applying to. Then it's submitting your application. Once you've fulfilled your prerequisites, you apply to a pharmacy school, and that's through our PharmCast or other administered program. We'll talk about that a little bit. And then you go through an interview process, and that interview process is usually pretty robust depending on the college or school of pharmacy that you're applying to. And then a decision is made, either an acceptance or a denial decision is often made. Sometimes a waitlist decision depending on the institution that you're applying to. So we'll kind of dive into the details of what that looks like. And in these next few slides, Just know I'm putting in UNMC examples just because that's a way to talk about it in a more descriptive way. So if you wouldn't be applying to UNMC, or if somebody you're working with wasn't applying to UNMC, that's definitely okay. I think most of these translate depending on the institution, but some of them may not. So I'll talk about UNMC just to make it more personalized, but just know that there may be little adjustments along the way depending on the institution you're applying to. So these are our prerequisite courses. I won't highlight every single one, but oftentimes it involves chemistry, biology, physics, anatomy and physiology, and then some of your math science courses. And then there's an elective kind of component to it as well. So we ask students to have 21 credits or a minimum of 60 credit hours after completing those prerequisites. As an example for UNMC, we take these credits from any accredited college in the United States and abroad. We do accept quote unquote old coursework, whatever that may look like for you, whether it's 5, 10, 15, 20 years in the past. We do accept old coursework. Obviously, it needs to come with an official transcript, but we do accept old coursework. And if you have questions about what this would look like for you personally, most colleges and schools of pharmacy have admission counselors or directors for admissions and recruitment. And I encourage you to reach out to those stakeholders wherever you might be interested in applying to, so that you can lay the groundwork for what a prerequisite component may look like for you. And they can meet with you one-on-one, whether it's Zoom or in person. And I would definitely encourage whoever was applying for a PharmD program in the future to set up a meeting to ensure that you have the path forward that would be appropriate to applying for pharmacy school. Different logistics with the application process once you've completed your prerequisite work. First, most colleges and schools of pharmacy use a liaison called PharmCast. This PharmCast program or organization helps to administer the application process for us, and then we go in as an admissions committee and review the applications in that portal. The admissions process runs usually from the beginning of July when PharmCast opens up, and then it runs oftentimes somewhere around the middle of the spring, and that can vary by institution. So it's important to know the deadline for the institution that you're applying to or applying for. Sometimes they cut it off March 1st, sometimes it's a cutoff in June 1st, and some maybe don't have a deadline. So it's important to be aware of what those deadlines look like. And then competitive applicants, after that application is submitted, are invited for an interview. Some different things with an application that you may be paying attention to, or you may be wondering about, well, am I competitive, or is somebody that I'm supporting going to be competitive for PharmD admission? I think as a pharmacy technician, you have exceptional background and are able to tell your story within an application. And so there's several points within the application where there's free responses or essay questions in respect to maybe what your journey has been prior to pharmacy school, why you're interested in pharmacy, what brings you into the conversation, or why you want to apply for pharmacy school, what you want to do in the future with it. And all of those, I think a pharmacy technician who has experience is well leveraged to be able to tell their story about how they've interacted with pharmacists, how they've participated in patient care, how they've cared about medication management, and some of the unique outcomes that maybe you've been a part of in that. In the application, we look for quality writing, good communication, and some creativity as well, without going ridiculously out of the box. But sharing your own personal story can come from a creative place. And then the essay component in the application process also allows for describing more information about maybe where your education started. Maybe you struggled a couple years in your undergrad to start off with and never finished school, but you came back and your trends for your grades improved as you completed your prerequisites, and you can describe that a little bit more in detail in those essays. Or you can describe some of the hardships that you faced within your educational programming. You know, sometimes, especially over the last 5 years, we've seen some of those hardships be the world of COVID and learning from a virtual perspective. And how students navigated that and all of the family dynamics that were involved in that time in those spaces. And so there's definitely an opportunity to share some of the hardships that you might have experienced throughout your schooling too. And then after the application process, it works into our interview process. So we would review your application, and then you would be invited for an interview as long as you met the requirements of the application. And so this often can be completed in person or virtually. Several colleges and schools of pharmacy are doing both. There's some that are only doing in person. But it depends on where you're applying. It often includes faculty from that College of Pharmacy, staff and administration from that college, and may often include a personal interview portion. So you meeting with another pharmacist faculty, or you meeting with some of the staff, maybe one-on-one or one-on-two, or sometimes they even have group interviews depending on where you're applying. Again, things that you can learn from the admissions professional within that college. It may also include a written activity. So you'd meet one-on-one or one-on-two in a personal interview, and then you might go into a written activity component. So that could be answering a question in more of an essay format. It may be doing more of a journal club activity where you have to answer questions about a scientific journal article. And then that would be evaluated as part of the holistic admissions process. Other things that might be involved on an admissions day would be getting a campus tour of the college, receiving more general College of Pharmacy information, and then lots of different colleges of pharmacy do it differently as far as how they personalize the interview process for their students. So you might meet with students of the program for a little bit of time. They might just give you time to spend with other candidates over lunch, or having scripted questions where you're able to talk and interact with those people that are applying to the school. And then after the interview, it goes into the decision. So oftentimes that decision is reserved for the College of Pharmacy Admissions Committee, at least at UNMC, that's the case. So there's a committee of faculty and staff that are on the admissions committee, and they look at the overall application as a whole. So that would include the application that you submitted, along with your transcripts, along with any work history that you would have, your answers to the essay questions, letters of recommendation, essays, and then possibly the interview and or written activity that was a part of the interview day. And some colleges of pharmacy include more information within that evaluation process, and some don't. But ultimately, it comes down to a committee decision, and then you would either be accepted for admission or you would be denied for admission, and that decision would be communicated to you. So that's kind of the overall process as to how it comes to a decision. And then once you're in, there's probably several of you in this room who know what this process looks like or are aware of what pharmacy school looks like, but just as a refresher, it's 3 years of didactic work. So you would spend 3 years in the curriculum for most colleges of pharmacy. There are some that are a little bit more expedited than this. So you spend 3 years of didactic work in the classroom and in laboratory skills lab settings to receive your education. And then in between your P1 and P2 year, and in between your P2 and P3 year, you would go on experiential work. So completing your IPPEs or introductory experiences. And some schools of pharmacies will layer those within the academic year too, whether it's your first year or second year. We reserve it for our summers where students go on these experiences in between their P1 and P2 and P2 and P3 year, which involves a month-long rotation either in the community pharmacy or in the hospital or clinical setting that way. And then P4 year is reserved for your experiential education, which we call AAPs, or advanced pharmacy practice experiences. And P4 year looks different ways for different colleges. At UNMC, it involves 10 rotations within a 12-month period. For others, it'll be 8 rotations, and they go on 5-week rotation, 5-week longitudinal experiences that way. And for others, they even extend it to 6 weeks. And so different types of experiential educations that are layered in within the program. So once you're in addition, what can you expect? Well, we don't leave you hanging once you get in. I think a key piece, at least at UNMC, and I know at Colorado they do this as well, is that culture in the community as a student is really important. And so you can have involvement in several different types of student organization and get involved in leadership that way. Several of our pharmacy technicians step into leadership roles within their own class as president or vice president or secretary. Oftentimes they have a nice perspective and understanding of the pharmacy profession itself, and so it helps leverage that information in a great way for their class. Lots of different types of class events that occur throughout the year, whether it's trivia nights, whether it's getting together at the bars or whatever it might be, just to get to know their classes. The co-curricular is really important throughout schooling too. So co-curricular is things that are helping our students become educated outside of just the curriculum that is scripted for them. So that could be interprofessional education events that we have scheduled. It could be working outside of the curriculum, working in our free and underserved clinics, like our sharing clinic, where our students get to go and provide free pharmacy services in an internal medicine clinic setting. There's different types of service opportunities throughout the curriculum, whether it's working through a student organization, going and providing blood glucose checks for patients, whether it's going and providing vaccinations, whether it's working in underserved communities and doing blood pressure checks and medication management checks. Lots of different service opportunities that are often a part of our student organization cohorts. At UNMC, we have a Spanish track where students can learn Spanish from a health profession perspective, and they work through that from their first year all the way through their fourth year, and there are specific kind of requirements to gain that certification. Several different work opportunities, whether you're connected to a health system like Colorado is or like Nebraska is or not, you definitely can work throughout pharmacy school. And that kind of depends on how well you feel like you can balance the work and the studying component, because the studying component is a full-time job as well. But you can definitely work as a pharmacy technician or a pharmacy intern throughout your curriculum as well. And then wellness is a really key component that we've really tried to dive into and develop over the past 5 to 10 years as well, where we're ensuring that our students are getting the support they need, whether it's through counseling on campus, whether it's through peer mentorship or mentorship with faculty and staff, and ensuring that our students are known and understood, and that we can help support them along their journey to becoming a pharmacist. So what does the curriculum look like? I won't dive into too many details here, but this is a script of what our curriculum specifically looks like. As you can see, it averages around 17 hours per semester. So it can be a significant lift for students. Oftentimes the P1 year is a little bit more manageable, and as P2 and P3 year ramp up, depending again of where you're going to school and what your College of Pharmacy offers, P2 and P3 year can be a little bit more heavy, especially from the studying perspective and just the amount of information that you're expected to know and retain. And then as you can see, the experiential component is a part of the curriculum and plays a significant role, nearly 25%, a little bit over 25% actually, of our curricular expectations there. A lot of our student organizations are putting on different community events. One of the things that we do at UNMC is we put on a vaccination clinic for flu season for the entire campus. And so our students help to coordinate that and ensure that any health profession, student, faculty, staff, or administration can come in from campus and get their vaccination. And then ultimately from there, you get to go and graduate. And we get to send you off into the great things that our students go and do. So that's a general overview, relatively, I guess, speedy overview as to how that may play out. I have some questions and answers and common things that kind of come up throughout our conversations with pharmacy technicians and students that are interested in applying to our PharmD program, but I'll pause here and allow for any questions initially so that I at least give some time for that, and then I can work into more some of the common questions that we get, if there's any questions. Yeah. 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 I think I could maybe answer that in multiple different ways. Yeah, the question was, thank you. Yeah, the question was, and remind me the exact program that you completed. Okay, great. So a bachelor's of arts in health psychology and a master or a minor in health science. Okay, great. So is that experience going to help you in pharmacy school and maybe apply to pharmacy school as well? Okay. So I think multiple different ways that can be answered. One, from a prerequisite perspective, there's probably courses that you took that align with some of the prereqs that are required for pharmacy school. So one, that's going to help you there. Two, if they don't specifically line up, at a minimum, they would help to fulfill those, for us, 21 credit hours of electives that could then be used so that you don't have to complete any additional electives and you just need to focus on maybe the organic chemistry if you hadn't taken orgo in that course or in that curriculum. So that's kind of a nice piece on the prereq side. I think that type of track also helps put you in the right perspective and mindset as to being prepared for a pharmacy curriculum. So any bachelor's in sciences, I think, can really help give you a nice foundation. Even if it was 5, 10, 15 years ago, it gives you a foundation as to understanding, okay, this is what it takes to study for an exam. I do think that there's a different level that that studying is required in the PharmD curriculum, but it at least gives you a little bit of a launching pad versus maybe not having that experience prior. So those would be kind of the two ways I would perceive that question. Any other clarifications or? Yeah. 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 Mm-hmm. Yeah, absolutely. And I think that piece, the resilience piece, and I think I may have had a piece of that where where did I have that at? Did I just pass it? Where am I? Okay, yeah. So the resilience piece, I think, really plays into that, and you can describe kind of what path you took to get to where you are, and then you can kind of the admissions committee can kind of understand where you came from in that, and maybe the different tactics that you would take this time, having some of the pharmacy technician experience that you have. Because a lot of our pharmacy technicians, especially in the first year of the curriculum, really come up with a step up above some students who maybe haven't worked in a pharmacy before because they've been around the medications, they've understood some of the dosing components, they've understood what it's being used for, why it's being used for. And even I think beyond that, they've learned a lot of the soft skills with it too, the communication aspect, how you deal with difficult patients, how you deal with difficult pharmacists and other colleagues that you work with, and navigating those types of things are things that really help to level you up as a student, I think, as you enter PharmD. So yeah, great question. Other questions? Yeah. The list that I provided should be the full list. Yep. And if you want more detailed breakdown as to the actual credit hours associated with those can be found on our website. And what was that? Yep. With the course coding. Yep. With those as well. Yep. Absolutely. And two, sometimes course coding can look a little bit different for the different types of institutions you would go to. So if you ever had questions about whether this specific course code would translate to the prereq, be happy to answer those. Yeah. That would be physics separate from calculus. Yeah. Correct. So you take physics separately, and or you could take quantitative chemical analysis with a lab separately, and then calculus would be a separate course from that. Yeah. Mm-hmm. Yeah, absolutely. So the physics if you take physics, whether it's with trig or with calc, we could definitely have that conversation, but that would probably be something that our College of Pharmacy would accept. Yeah. Correct. Yeah. So So biochem has been removed from our prereqs. It's a course that we actually are given in P1 year. And so, yeah. That was a relatively recent change, but again, not all College of pharmacies have it. Yep. Yeah, it is. So, yeah, great point. Yeah. Yeah, so if you've completed courses within that are the same courses as our PharmD curriculum, we traditionally do not waive those courses. We have our students complete those because they're more pharmacy centric within that. So if there's any that match, then that would be the case. And the question was, if you took some graduate level coursework or you graduated from a graduate program, would those translate to PharmD, or would you have to maybe take those over? Does that answer your question? Okay. It would depend on what that prior learning looked like. So again, maybe going back to the previous question, if you have graduate work that met some of the prerequisites, great, those would line up. If it didn't meet the specific prerequisites listed here, it would still fulfill a lot of that general education bucket of those 21 credits. So then you would just need to focus in on the prereqs that are listed above, at least for UNMC. Yeah, good question. Yeah. Yeah. So again, that varies by the institution that you're applying to. For College of Pharmacy, for UNMC, we actually don't have a difference between our tuition for in-state or out-of-state. So if you come from out-of-state, you would have the same tuition as an in-state applicant. Yeah. Great question. Other questions? All really good. Yeah.
What is your average course or class size? Are you currently accepting or like what?
Yeah. So our average class size is at 60 and so we usually have our goal or our target is to 240 throughout the 4 years. So P1 to P4 year. As for this year, we are maxed out as to the applicants we're taking for next fall. But our new year of recruitment starts opening up in the beginning of July. Yeah. Yeah, great question. So I do have that in my question and answer slides coming up. For us, and there's probably going to be a little bit of change this summer, but for us, it's looking at about 30,000 per year is what it's looking at. So yeah, so it'd be 15 per semester, which I'll share a little bit of ranges and averages as to how it relates to the Big Ten average as well, and looks a lot of different ways. Yeah. Other questions?
Just to let you know, CU here is not quite that high, but
okay, about right. Okay. Yep. you go. Other questions? Okay, yeah.
Based on the demands of the course,
Mhm. Yeah, so the question was, based off the demands of the coursework, how much can students work or how much do we kind of recommend? Yeah, and for me, usually a student entering into P1 year, 10 to 15 hours is probably a safe place to start. Some feel like they have the capacity to go into 20 to 25 hours. Usually that involves weekend works to get the 8 hours on the weekend and have still some leverage time to be able to study. But it kind of depends on the student. Yeah, 10 to 20 per week. Sorry. Yep. So it kind of depends on the student. And I think some of our pharmacy technicians who have worked previously, who aren't onboarding and kind of understand the system, they can start off maybe at a little bit of a higher clip than some of our other students. Yeah, great question. The other question? Yeah, so our retention rate at Nebraska, we're right in like the 97, 98 percentile on the retention rate, and the same kind of works the same way on the graduation rate. Yeah. Good question. Yeah. Other questions? Okay, great. Well, I will just move into some question and answers. There's some common things that come up, and some of those already did come up too. How should I select the right pharmacy school for me? I think it starts off with having strong NAPLEX and strong MPJE pass rates. So making sure that the investment you're putting into school with both your time and your finances can then ultimately allow you to be able to pass the exams that are required to get your pharmacy license. And so take a look at that. Student job placement and or residency match rates. If you're interested in working in a specific area, just determining whether it makes sense or whether that institution is preparing you for that type of work, whether it's community pharmacy, whether it's health system pharmacy, whether it's industry. Having some sort of specific knowledge in those spaces and getting education in those, making sure that the College of Pharmacy offers those. Having dedicated faculty members, engaging staff members, you can learn a lot about that in your interactions leading up to and applying for pharmacy school, and often happens on interview day as you interact with some of the faculty, staff, and administrators. Asking about student support and other supportive services. So are there counseling opportunities, both from maybe a tutoring perspective, but also from a mental health perspective? Are there different wellness events and things that are being put on to support students? Are there professional counseling opportunities, peer support groups? Is there access to a gym? All those types of things may be something that you're interested in as an applicant. What's considered a competitive GPA? There's not a standard set GPA for pharmacy school specifically. I think by and large, a strong GPA is often considered greater than 3.5, and that's similar for consideration into pharmacy school, but that does not mean that you have to have a 3.5 to get into pharmacy school. A strong background in pharmacy work with trends in the right direction for your education, for your prereqs that you might be completing, are things that the admissions committee looks for, as well as strong letters of rec, maybe from people that you've worked with closely over a long period of time. I think my personal bias is that a career as a pharmacy technician is an excellent background to have within the profession and seen as a strength as an application and as an applicant, especially when reinforced with the positive letter of rec from the people that you've worked with. How expensive is pharmacy school? That question got brought up a little bit earlier. Tuition can range significantly across the board, depending on your school selection. I encourage you, as you look at tuition rates on those College of Pharmacy websites, take a look at what P1 to P3 tuition is, and the difference, if there is any difference between that and the P4 tuition. Sometimes that P4 year can look a little bit different than P1 and P3 year, which can be a little bit deceiving. So make sure to take a look at the total picture. Ranges in the Big Ten Conference as to how it may play for a full 4 years. is $96,000 to a total of $153,970. That can be very variable too. It can be below that or above that, depending, even if you get outside of the Big Ten conference. Financial aid is an option with scholarships and loan opportunities, and definitely would encourage you as you're applying to ask about those and what it might look like for you to apply for those scholarship opportunities even before you set foot on campus. And then what is pharmacy school like? Got to answer some of those questions already, but it is a rigorous curriculum. It requires a lot of time, energy, and investment on your part. But most students can balance some work on the side. Again, 10 to 20 hours per week seems to be the going rate. I would say, especially your first year when maybe the curriculum isn't as significant, you're maybe trending towards 15 to 20 hours if you can balance it. And some of our students don't work, which is okay as well. And they kind of take their time and dedicate that to their studying. Community of students with like-minded individuals, I think, is a really important part of pharmacy school. You're not just hopefully doing this alone in a silo, but you're working with other pharmacy students to be able to achieve your goals. And sometimes I think that's a little bit different than maybe the undergrad route, where maybe you feel a little bit more siloed, or you feel like you're kind of on your own in achieving your goals. In pharmacy school, the way that I've seen it with our students is that they're there for and with each other. And ideally, that's how we like our community to be, so that they can reach their goals. And I think it's achievable for all walks of life. Just looking at our past graduating class, it fits all these different types of demographics, whether you're single, married, with or without kids, caretakers of other family members. There's definitely ways to make it work. That doesn't mean that it's not harder or maybe more challenging, or you have to navigate more barriers with certain situations than others, but it is achievable. And talk about key skills a little bit, but I think as a pharmacy technician, you start to develop these in your own work, whether it's resilience, professionalism, time management, excellent communication. All of those things really, I think, would leverage you as an applicant, or the people that you're supporting as applicants, if they have significant technician work. Some people are interested in research too as they walk into a PharmD program. You definitely opportunities as a student to be able to participate in research, whether you're interested in more of the pharmaceutical sciences side of drug development, or if you're more interested in the translational or clinical research side of looking at actual patient outcomes in the real world space. Some of our students will progress into research intensive positions post-grad. A larger majority end up going more of the community pharmacy route or the health systems route that way.